Everybody comes to us in various stages of injury. Sometimes they get hit by a car and the injury takes place all at once. And sometimes it takes place over a really long period of time, but it's in various stages. So if somebody comes to us and the condition is, not characterized by a whole lot of damaged tissue, but they're on the path to developing those things, then this might not be the right place. It might not be an interventional process where we have to go in and heal tissue. In those particular circumstances, we usually give them recommendations for, improving their metabolic state so that they can ultimately become healthy and prevent things from continuing to break down, but also getting them out to the right conservative care practitioner so that they can restore function. Well, I think the big difference in terms of evaluation between, an individual or an office like ours and a traditional orthopedic office is, they're evaluating based on pathology and symptoms, right? Initially, if there isn't a whole lot of pathology, but there's symptoms, then they usually send them to conservative care. Conservative care can come in the form of physical therapy or chiropractic care, and that's functional based, and that's really where they should be. Essentially, if they do well in conservative care without any real pathology on film, then we've done our job, the patient's doing well, we've restored function, their symptoms are less or completely gone, and we can kind of go about our business. But if there is pathology on film, then the first step would be to manage the symptoms associated with that, as opposed to taking an approach that can heal and change the pathology on film. And more importantly, if they fail in a conservative environment, that usually indicates that they do have some structural issues in the form of damage to their spine. We call that arthritis, right? And it could be a disc herniation, it could be many things, but in a typical arthritic condition, we see, all the changes that I described previously. The way that orthopedists, look at things or evaluate conditions is based on the tools that they have at their disposal. They typically only have drugs, referral for conservative care, and surgical intervention. The problem is that doesn't really fix the underlying issue or the reason that they have pain, and as a result, those conditions are allowed to get progressively worse over time. And once they get to a certain threshold where they are progressively worse, and now they're what we call complicated because maybe they're affecting some neurology or nerves, maybe we have a radiculopathy like a sciatica type pain, maybe we're starting to develop some weakness, then they will be evaluated from a position of surgical intervention. The intention at that stage of the game is, okay, well, what do we need to cut out in order to, make up for the actual dysfunction that might be present? When it comes to the Meta 3 protocol, the reason that we developed that is because what we want to do is we want to look at all of the aspects, all of the things that contribute to chronic joint pain. It's typically characterized by damaged tissue. We have dysfunction of the joint, as functional, it's not as strong, it's not as stable as it should be. And we have some type of metabolic influence. The easiest way to understand that is if we're chronically inflamed, then essentially our body's going to break down at a faster pace. And it's something that we have to deal with, especially if we're trying to repair things. I use the analogy, the alignment on a car, because it really just makes the most sense. If the alignment's off, the wheels are going to wear out. The faster we drive the car or the more inflammation we have in our body, the faster they're going to wear out. If we're going to solve the problem, we can't just put tires on the car. We have to address the alignment and we have to slow the car down so that we can be effective in terms of the treatment that we use. Do you know anyone who would find this information useful? Please share this video with them. We want to educate as many people as we can.